So we will start with this picture, and you can see that here are the arteries, capillaries, veins, and venules. So why the flow velocity is the highest in the arteries? Because they have the largest radius. The aorta have the highest flow velocity. Okay, and the capillaries have the smallest flow velocity, and the blood volume can be found at its highest rate in the veins and the venules because they are very compliant and they distend and they accommodate blood, and the pressure it's at its highest in the arteries, slightly decreased in the arterioles, more the highest reduction. The smallest pressure is in the veins and the venules, but the greatest reduction in the pressure it's in the capillaries. Why? Because the capillaries are arranged in parallel and they are arranged that way to allow the body to provide nutrient exchange for the tissue. And here, the arteries and arterioles have the highest pressure because they have the thickest walls and the more elastic walls. They are the less compliant and they repel and they constrict more than the veins and the capillaries. So the vascular resistance is higher in the arterioles because of the highest amount of smooth muscle in the arterioles. They are the regulator of the blood pressure, actually, arterioles.
Mm.
So the preferred blood flow velocity, it's the our understanding that the blood must travel with greater velocity through regions where that have the smaller cross-sectional area, and the cross-sectional area it's the sum of the radius. So why would you think that the cross-sectional areas of the arteries are smallest than the cross-sectional areas of the capillaries? Because the number of the arteries is very small. They have the widest radius, but they have the smallest number. So the arteries have a small number, but the capillaries have higher number. And when you sum their radiuses, it will give you a higher cross-sectional area. So the capillaries have higher cross-sectional area, so the flow velocity is lower, while the arteries have largest radius, but still they have a very small cross-sectional area because they are very few in number when they are compared with the capillaries and the veins and the venules. So the flow velocity will be higher. And normal flow through all the vessels in the cardiovascular system is called laminar flow. So the flow velocity is important because the normal flow in the vessels govern the coagulation system and govern the inflammation and inflammatory process. I think it's clear.
Yep.
So velocity is fastest along the central axis of the tube and falls to zero at the walls. So if we are having a tube here, we are talking physics here. So
Yep.
the velocity will be at its highest in the central axis of the tube, and it will be at its lowest in the periphery of the tube. So so the blood in the periphery exert a shear stress on the walls of the vessels. With laminar flow, the shear stress on the walls is proportional to the rate of the flow through it. So you have to know that when we have a laminar flow, the shear exerted on the wall by the flow of the blood is proportional to the rate of the flow itself. And this is important because it activates the coagulation cascade. So if there is any abnormalities in the flow, the coagulation cascade may be activated. So the shear stress may also be an important factor in certain pathological situations such as atherosclerosis. And when the blood moves with too high velocity, like in the aorta, for example, through a narrow opening, laminar flow pattern may break down and become turbulent flow, and the vessel resistance become higher than that predicted from our equation that is governed by the flow that is governed by the velocity, the viscosity, and the length and the radius, which is called the Boisel equation. So what I'm talking about here is what I mean is the shear stress is the stress exerted by the flow of the blood to the wall, and it's a very important factor. This shear stress is dependent, or it depends on the flow pattern. When the flow is laminar and the velocity is high, if there is vasoconstriction or increase in the resistance or narrowing of the radius of the vessel, the flow may become turbulent. So if we are having a tube here, and this tube is having a high velocity flow, and there is a normal shear stress, if there is any narrowing of this tube because of atherosclerosis, for example, the flow become abnormal. The normal flow looks this way. So when there is any abnormalities like narrowing of the tube at any point because of atherosclerosis, this is a building up fat narrowing the tube here. So the flow in the middle here become turbulent, and this turbulent flow activate coagulation cascade. You see, how this body is precise. If the flow of the blood is changed, some certain biological steps and some certain biological activities take place. Very precise. The turbulent flow, part of that, generates abnormal sound, and it can be heard with a stethoscope, and the detection occur in the arteries, and it's called bruits. So when we have a bruits, that means there is an stenosis in the vessel. The vessel is stenosed. So turbulent flow sometimes occurs normally in the vessels that have high velocity. So the presence of fluid in large arteries does not indicate abnormalities. If you can auscultate a large artery sometimes. So you can see the picture here. You see the
Yep.
the laminar flow. Laminar means laminated. So this is laminated flow. It's laminated. It's regulated and nice and clean. So this laminar flow exerts a shear stress on the walls. If there is any abnormal vasoconstriction when the velocity is high, the laminar flow becomes turbulent. This turbulent flow produces a sound and activate coagulation cascade. I think it's clear.
Yep.
Yes.
So again, for you, minor revision, look at the picture again. The velocity is high. At highest in arteries, the blood volume, highest in veins, pressure, arteries and arterioles, resistance in the arterioles, and the capillary have the smallest or the highest drop in the pressure. So, talking about the volume, approximately 20% of the total volume contained in the pulmonary system. Pulmonary system actually receive 100% of the cardiac output, and it keep 20%.
Okay.
So you can look, you, you have to know that most of the circulating blood is contained with the venous system, 60%, and the peripheral veins act to influence cardiac output and the blood pressure because they are keeping the blood within them. And as we said in the previous lecture, there is something called the intrinsic pressure of the system. And this intrinsic pressure of the system is calculated by measuring the volume, circulating volume, which is the 60% in the veins, and divided by the compliance of the system. And it's 7, if you remember. So, going to talk about the pressure again, picture to remind you. So the pressure is higher in the arteries and arterioles, and there is there are two components of the blood pressure, systolic and diastolic, according to the timing of the heart muscle contraction. So the pressure because it during the heart contraction is called the systolic, and during the heart relaxation is called the diastolic, and the difference between them actually increases as long as we are moving from the heart. So as long as we are moving away from the heart, the difference between the diastolic and systolic pressure increases. So the average pressure in the aortic arch is 100 millimeter mercury, and a large pressure drop occurs in the arterioles, and a highest pressure drop occurs in the in the capillaries. I'm sorry. The average capillary pressure is approximately 25 millimeter mercury, and the central venous pressure is normally 0 millimeter mercury. So you can look to the picture again. So if you focused here, the difference between the systolic and the diastolic is increasing as long as we are moving from the heart. I think I was wrong when I said that the highest drop in the pressure occur in the capillaries. It occurs in the arterioles. It occurs in the arterioles to permit the capillary to exchange. But the smallest pressure found in the veins, and the capillaries have smaller radius than the arteries and the arterioles, but they still have smaller pressure because they are arranged in parallel. This is the correct saying. Okay.
Yep.
يا دكتور
Asking about the velocity during vasoconstriction and vasodilation. And you have to consider what does the velocity mean and what it depends on. It depends on the cross-sectional area. When we do vasoconstriction, what happens to the cross-sectional area? It decreases. So the velocity decreases. So the peripheral vascular resistance, the pressure difference and the flow are related by the basic flow equation. So the basic flow equation is flow, which is Q, directly proportionate to the difference in the
The
pressure
pressure gradient.
and
Mhm.
and inversely proportionate to the resistance. The flow is a cardiac output which is directly proportionate to the mean arterial pressure, which is the difference between the ventricle and the atrium, and inversely proportionate to the total peripheral resistance. So the mean arterial pressure equals or directly proportionate to the cardiac output multiplied by total peripheral resistance.
Okay.
So the pressure drop occurs across each of the vascular regions, from the arteries, the arterioles, to the capillaries, to the venules, to the veins. And each drop occur is a direct reflection of the resistance to flow within that region. So the blood is flowing, the resistance increases, the flow decreases. The blood is flowing, the resistance increases, the flow decreases. The blood is flowing, the resistance increases, the flow decreases. So when we are giving a patient a vasodilator, it decreases the resistance, so the flow increases, and the flow increases, the pressure increases, and this will lead to edema. This is the physiological mechanism through which calcium channel blockers and vasodilators causes peripheral edema. So the pressure drop was mentioned, and the large pressure drop occurs through arterioles. It occurs, as we said, because arterioles present a large resistance to flow. Have the highest resistance, the arterioles, because if you focused here, remember, look, the vascular resistance is at highest in the arteriole. So the highest the resistance, the highest the drop. The overall vascular resistance of the organ must equal the sum of the resistance of the consecutive vascular segments, which is the resistance of the arteries, arterioles, capillaries, venules, and the veins. So when we are talking about the resistance in the specific organ, we are talking about the resistance in the arteries that supplying this organ, and the arterioles and the capillaries, venules, and the veins. So when there is a vasodilation of any part of these segments, it will affect the flow to the organ. And when there is decrease in venous return, this will affect the flow of the blood to these organs.
Mhm.
The overall vascular resistance is determined mainly by the arterioles because they are the most segment that change its diameter. The blood flow is primarily regulated by adjustment of their diameter, and this occur by contraction and relaxation of the smooth muscle. So we were talking about the velocity and we talked about the aorta. We were talking about the volume and we talked about the veins, and we were talking about the pressure and we talked about the arteries, and we are talking now about the resistance, and we mentioned the arteriole. So the following diagram will help you understand. You can look here. We have the blood pressure on our left side in the x-axis, and in the y-axis we have the segment. So in the arteries, the blood pressure is at its highest, and the massive and the highest drop occur in the arterioles because it has the highest resistance. So the pressure phase, the blood flowing phase, the highest resistance in the arterioles. So the massive drop occur, and then it steadily drops equally in the capillaries and the veins and the venules. Still, the capillaries have the smallest radius, but still there is no massive drop like in the arterioles, and it can be considered as equal as the veins and the venules because it have a very high cross-sectional area and it's arranged in parallel. So the dotted lines, the first one here, the decrease in the pressure upstream to the arterioles indicates that there is a vasodilation. So when you vasodilate the arterioles, you decrease the pressure upstream. You decrease the pressure upstream. And when you vasoconstrict the arterioles, when you cause this vasoconstriction, the arterioles, what happens upstream? You increase the pressure. But what happens downstream? You decrease the pressure. So you allow reabsorption. This is when you vasoconstrict the arteriole. When you vasodilate the arterioles, when you vasodilate upstream, I said you decrease the pressure. Downstream, you increase the flow and the pressure, and this causes filtration from the capillaries and peripheral edema. So the bold black dotted line here indicates the action of calcium channels blocker, and this faint dotted line here indicates the action of sympathetic nervous system. I think it's clear. So the total peripheral resistance, the overall resistance to the flow is called the total peripheral resistance. And when we are talking about the total peripheral resistance, we are talking about the resistance of the body that's dependent on the resistance of each organ. So the organ 1 and the organ 2 and the organ 3, like the heart, the kidneys, the brain, and the livers, are arranged in parallel. So the total resistance decreases when there is an increase in each individual resistance. When we add a resistance, the total peripheral resistance increases. When we remove a resistance, when we add a resistance, the total peripheral resistance decreases. When we remove a resistance, the total peripheral resistance increases. It's in parallel. The same equation, right? So you have to understand that the total peripheral resistance is governed by the elastic properties of the arteries and the veins. So descending pressure is the difference between the internal and external pressure of the vascular wall. So if you have a blood vessel and we are talking about distending this vessel, so the descending pressure, the pressure that PD, pressure that distend the vessel, is the difference between the internal pressure PI minus PE, which is the external pressure. So this PE and this PI are the factors that govern the distension of the vessel. The volume pressure curve for systemic arteries and veins will be shown in the next figure to ease the understanding for you. And you have to know that the elasticity of arteries allow them to act as a blood reservoir on a beat to beat basis. So the artery can keep the blood only for the time of the beat of the heart, but not longer like the veins, which accommodate the blood for longer time. So the descending pressure, external and internal, the volume pressure curve will be shown, and the elasticity for the arteries allow them to conserve blood for only beat, one beat to beat situation or basis. So you can look here, the descending pressure from 0 to 100 and the volume of the blood. So in the arterial compartment, a change in the pressure will slightly affect the change in the volume. Massive change in the pressure will slightly affect the change in the volume because the arteries are less compliant than the veins. So when we are saying this structure is very compliant, we mean that we when you descend the structure, when you descend the structure, for example, you rush 1 liter in the structure, you will have a very high increase in the pressure for 1 liter. But if the structure is compliant, when you push 1 liter, you will have a very small increase in the pressure. So a very high change in the pressure will be associated with a very small change in the volume. And a very small change in the volume will cause a very high change in the pressure. This is low compliance. This is what low compliance means, because compliance is directly proportionate to the change in the volume divided by the change in the pressure. So as long as the change in the pressure is high, the compliance is low. And a small amount of blood volume ejected in the arteries will lead to a very high change in the pressure than in the veins. While in the veins, a very small change in the pressure will cause a massive change in the volume, but a higher change in the volume than in the arteries will cause a small change in the pressure. So it's a very compliant, can be descended, it can be constricted. So when the pressure increases, the compliance decreases. And in the veins, if you constrict the veins, because they are very compliant, the volume decreases rapidly and the pressure is steady. There is no massive increase in the pressure in the veins like the arteries. So this is very important because when we are saying vasoconstriction, arterioconstriction, or venoconstriction. If you are saying venoconstriction, this will affect the preload. If you are saying vasoconstriction for the arteries, this will affect the pressure. So I think this make the most of it.